Children often test the limits of their parents and authority figures. Some level of disobedience and rule-breaking is a normal and healthy part of childhood. Sometimes, however, that behavior can be persistent and frequent. This ongoing hostile or defiant behavior could be a sign of oppositional defiant disorder, ODD. OD is a type of behavior disorder. Children with OD often act out. They throw temper tantrums, defy authority figures, or are argumentative with peers or siblings. These behaviors may happen only at home, around parents. They may take place in other settings, too, such as school. It is estimated between 2 and 16% of school-aged children and teens have OD. Symptoms of OD can appear as early as 2 or 3 years old. However, it's more likely they'll show up between ages 6 and 8. If OD is not addressed and treated in childhood, the child may develop long-term, chronic problems. These issues can last through their teenage years and into adulthood. Keep reading to find out what OD is, how it's diagnosed, and what can be done to help a child who has it. What are the symptoms of OD in children? Children with OD will show several of these behavioral symptoms: inability or refusal to obey rules, easily frustrated or quick to lose one's temper, repeated and frequent temper tantrums, fighting with siblings or classmates, arguing recurrently, deliberately upsetting or annoying others, being unwilling to negotiate or compromise, speaking harshly or unkindly, defying authority, seeking revenge, being vindictive and spiteful, blaming others for one's behavior. In addition to behavioral symptoms, a child with OD may have one or more of these symptoms: difficulty concentrating, difficulty making friends, low self-esteem. Persistent negativity. Symptoms of OD may ultimately interfere with learning, making school difficult. Challenges at school may further frustrate the child, creating a cycle that could lead to more symptoms or outbursts. Teens with OD may be able to internalize their feelings more than younger children. Instead of lashing out or having a tantrum, they may be angry and annoyed all the time. This could lead to antisocial behaviors and depression. What causes OD in children? It's unclear what causes OD. Researchers and doctors believe a series of issues may play a role. Johns Hopkins Medicine says that can include developmental stages. All children go through emotional phases from the time they're born into adulthood. Successful resolution of those stages helps the child grow and develop emotionally. However, children who do not learn to be independent from a parent may be at higher risk of developing OD. These attachment issues could start as early as toddler years. Learned behaviors. Children who are surrounded by a toxic or negative environment may absorb it into their own behaviors. Parents who are excessively strict or negative may reinforce bad behavior that gets them attention. As such, OD may be born out of a child's desire for attention. Several other factors may be linked to OD. These include a permissive parenting style that doesn't have clear boundaries for appropriate behavior, personality traits, like a strong-willed stress, or turmoil in home life. What are the risk factors for developing OD? Risk factors for OD include family discord. Children absorb a lot of what happens around them. If they are surrounded by dysfunction and conflict, their behavior may suffer. Exposure to violence and substance abuse. Children living in an unsafe environment may be more likely to develop OD. Gender. Before the teen years, boys are more likely to develop OD than girls. By adolescence, this difference goes away. Family history. A history of mental illness may increase a child's risk for OD. Other conditions. Children with OD may also have other behavioral disorders or development disorders. For example, about 40% of children with attention deficit hyperactivity disorder, ADHD, also have OD. How is OD diagnosed in children? The recent Diagnostic and Statistical Manual of Mental Disorders, DSM-5, recognizes OD. Healthcare providers can use the criteria in the DSM-5 to determine if the child has OD. These criteria include a pattern of angry or irritable moods, argumentative or defiant behavior, vindictiveness or spiteful reactions. These behaviors must last at least 6 months. They must also involve at least one individual who is not a sibling. Doctors will consider a child's age, the intensity of symptoms, and how frequently they occur when making a diagnosis. A child's pediatrician may prefer to refer your child to a child psychiatrist or mental health expert who can diagnose OD and develop a proper treatment plan. What is the treatment for OD? Early treatment for OD is imperative. Children who go untreated may develop worse symptoms and future behavior problems, including a conduct disorder. These behavioral disturbances can and will eventually interfere with many aspects of your child's life, from finishing high school to holding a job. Treatment, however, is not a one-size-fits-all prescription. Most treatment for OD is centered around therapy. You and your child may have to try several types of therapy until you all find the one that works best. What's the outlook for children with OD? Some children with OD will eventually outgrow the disorder. Symptoms may disappear as they age. However, as much as 30% of children with OD eventually develop a conduct disorder. About 10% of children with OD may eventually develop a personality disorder, like antisocial personality disorder. That's why it's important you seek help early if you believe your child is showing signs of OD. Early treatment can go a long way to preventing severe symptoms or long-lasting effects. In teen years, OD can lead to problems with authority, frequent relationship conflicts, and difficulty forgiving people. What's more, teens with OD have an increased risk for depression and substance abuse. The takeaway: oppositional defiant disorder is a behavior disorder most commonly diagnosed in children and teens. In children, symptoms of OD can include hostility toward peers, argumentative or confrontational behaviors toward adults, and frequent emotional outbursts or temper tantrums. If left untreated, OD can become worse. Severe symptoms may interfere with your child's ability to participate in school or extracurricular activities. In their teen years, it can lead to a conduct disorder and antisocial behavior. That's why early treatment is so important. Therapy can help your child learn to respond better to their emotions and better shape their communications with you, their teachers, their siblings, and other authority figures.